Welcome, everyone. I'm Susan Stoles, Senior Manager, Professional Strategies at Fresenius Kebi. I have the privilege of introducing our esteemed presenters for today's session. We appreciate your interest in our topic, drug diversion risks in the ambulatory setting. It's sure to be a lively discussion of the challenges and the opportunities. Hold on a minute. Throughout the presentation, we encourage you to submit your questions using the Q&A functionality. Now for our introductions. Kimberly New is a specialist in controlled substance security and DEA regulatory compliance. As partner of diversion specialists, she assists facilities across the country with diversion investigations, diversion program development, staff education, and crisis management and remote auditing. Kim is a nurse and an attorney. She is also co-founder and executive director of the International Health Facility Diversion Association. Keith Berg, MD, is an associate professor of anesthesiology at the Mayo Clinic College of Medicine and has been an anesthesiologist at the Mayo Clinic for 30 years. He performs research, is well published, and lectures extensively on the prevention and recognition of substance use disorders in anesthesia providers. He has a career-long interest in improving drug control systems in the operating room environment. He has assumed a broader role in dealing with the issue of drug diversion by heading Mayo Clinic's drug diversion prevention efforts both locally in Rochester and nationally at all Mayo sites, up into his recent retirement from that role. I would like to offer that there are a few disclosures. Tonight's presentation, both Keith Berg and Kimberly New are acting as speakers for Fresenius Kebi USA. It is now my pleasure to introduce Kim New.
Thank you very much, Susan. So our learning objectives for this evening include learning about the scope of the problem of drug diversion. I'm convinced that many of you already know quite a bit about drug diversion, but hopefully you'll have some new information here in this webinar. Also understand the implications on staff, patients, and the facility. And that's actually something that is really important because many times it's difficult to imagine all of the potential victims when diversion happens. Recognize barriers to diversion auditing and grasp and implement measures to protect yourself in your work environment. So what is diversion? Diversion is the transfer of controlled substances from one lawful to an unlawful channel of distribution, or simplified, it's just simply taking or stealing medication, including waste, from patients or healthcare facilities for personal or unauthorized use. It's important to include waste when you're looking at diversion because waste is a very, very common source for diversion. And we'll talk a little bit more about that in a few minutes. Diversion is a substantial risk in any facility that uses controlled substances. There really is no facility that is immune to this type of activity. It happens in large hospitals, large academic centers, and very, very small ambulatory surgery centers or outpatient procedural areas. The major factors impacting the incidence of drug misuse by healthcare professionals are access and availability. And all facilities must treat diversion with the same diligence as they do other patient safety initiatives because it's an ever-present risk. Many times when I'm talking with staff about diversion, they offer me kind of what they think a diverter would look like. And many times it's a picture of someone who is very impaired, someone who is clearly showing very obvious signs of substance abuse. Many times it's someone who isn't well kept up, someone who isn't a good worker, someone who may be calling off for work a lot. But we put these pictures up just to show you that really these do not necessarily fit. These folks don't fit that preconceived notion of someone who is stealing and abusing drugs. People who are involved in diversion are oftentimes, top performers. They are well respected and well liked by their peers. So among the faces that you see here, and I'm not going to go into each one, but one of the folks here is a radiology technician who actually diverted, as he worked as a traveler in an interventional radiology as well as the cardiac cath lab. He would take fentanyl syringes that were prepared for cases, inject himself with the contents, fill the syringe back up with saline, and put those syringes back for use in patients.